Welcome to this advanced Hydrus microstent video. This will be a temporal Hydrus implant sitting on the nasal aspect. I typically do this when there is another implant or there's a plan for another implant on the nasal side, or sometimes the nasal angle has already been damaged with trauma or prior procedures. So the key to sitting nasal is a couple things. Just a refresher on the orientation. The nose, of course, is going to get in the way, and there's another eye right next to me, so our normal hand position will not work for the nasal position. Typically, I'll start with the subconjunctival 2% with epi. Again, this is so that the Hydrus implant is completely painless and without any sensation at all. The patients do tend to jump if they can feel anything, and with Hydrus I find they often do. So the head is tilted towards me, and I'm asking them to look away with the eye. This actually puts the eye in a very neutral position, and notice that I've got an overhand grip. Because of the location of the nose and the rest of the face, we can't hold our instruments in the typical fashion with the instrument on top. You have to reverse that so that my hand is on top and the instrument is underneath. It is awkward and different. Here I am putting the paracentesis. Notice that angle. The line delineates the location, and this is designed to get us that 4 clock hours apart. So the Hydrus will go in at the 3 o'clock part, where the paracentesis is at 7. Again, I add some non-preserved to enhance the anesthesia. I want absolutely no sensation when this Hydrus is going in. So now we'll complete the cataract wound. Basically, it's a nasal orientation, but it is essentially a standard groove and biplanar tunnel, similar to a regular cataract wound. I find these wounds really straightforward and extremely good at sealing. You notice that little dimple there for the second plane. There's something about the overhand technique going over the nose seems to make an excellent wound. I haven't been able to duplicate that as well for standard cataract surgery. Now we'll do a basic inflation, and then we're going to reposition the head. Now here is very important. The head is neutral and the eye is away. This is not typical. Typical Hydrus, you'd have the head away and the eye away. Here we want the head just up at neutral and the eye away. And this is, again, because we're working over the nose. And if we tilt their head away, we will have no access at all. So depending on how much they can look away, determines how much I tilt the head. I can do a little or a lot based on how much eye movement they're able to produce. So here I am trying to find our en face view. I think I finally got it here. And I'm going to do whatever I need to do with the head, with the eye position, with the scope, to make sure I have a very comfortable view. Because what's not going to be comfortable is the implant. So first I'm going to adjust the angle of the Hydrus by rotating it, and this is determined completely by the nose and the face tilt and whatever access I have. So once I think I have everything set, we're going to go into the meditation, relax, deep breath, calm everything down. I typically enter with the Hydrus pointed down, but in this case I had to go up because, again, I'm working over the nose and my access is limited. So now I do the typical focus on the tip of the Hydrus, and as I advance towards the angle, I change the focus at the same time. This is a simultaneous procedure where I'll be advancing and changing the focus. You'll notice here I'm getting in a little trouble with my visualization, and what we can't see here is the patient is trying to look back at the scope, and I'm struggling. I don't realize exactly what's going on. I don't have a good en face view. Eventually I get them to settle down, I realize I'm not on FOSS, so I'm going to make some adjustments. A little partial attempt there. I realize it's just not going to work. Here I am. I'm asking them to look away, getting a much better view. There it is. So now I say I have a good view. I let everything settle down, and then I go after it again. And this time I have a real nice attack angle, and I can get it to sneak right in there. Once you have the inserter and the angle lined up properly with that on-FOSS view, everything will go very smooth. Again, the other difficult thing to show is the z-axis, where we're pressing a little bit against that back wall to make sure the Hydrus launches at a good posterior direction, or in this case lateral direction, so that it skirts into the tunnel without dissecting the meshwork. The Hydrus is really good at doing that if it's not directed a little bit towards that posterior wall of the canal. Here you'll see me just tapping it a little tiny bit and making sure it's seated properly. Sometimes I do like to just give it an extra check. I always like to take a look around, make sure I see the windows properly in the canal, and then I know I've got everything where I need it. So, in summary, we really want to make sure the initial wound, the head is towards us, the eye away. That gives you the proper orientation. Overhand grip, and then for the implant, the head goes back to neutral and the eye is away. Whether it's superior or inferior is really determined by whether they can look up or down, and you might actually need to be able to use both hands for implanting, because sometimes they just cannot look in the direction that we need them to look. This is an advanced technique. I do not recommend new Hydrus inserters attempt anything like this until you're very, very comfortable with the basic Hydrus implant. Please look at some of my other videos for Hydrus basics. And we've had the Insta 360 1X cam with Teresa helping me out there, doing a fantastic job as always. So the follow-up is readjust the head, get a nice view of the entire eye, make sure my wound is good, make sure the chamber is stable. Sometimes there's little reflux heme here. Most of the time there is. In this case there isn't. Again, final reminder of the orientation. This is a nasal seating for a temporal Hydrus implant. This one went supero-temporal. I can also do infero-temporal if needed as well, depending on the way they look with their eye position. And thank you very much.